So thank you, everyone. Thank you for joining. My name is Josephine Crisostamo. I'm a program manager for the Strategic Partnerships team at the Mayor's Office of Community Mental Health. And I'm joined today by Dr. Christa Labouliere, an assistant professor of psychology at New York State Psychiatric Institute. Hello, Dr. Christa.
Hello, good morning, everyone.
Thank you all for being here with us today. So let's get started. There we are. So the Mayor's Office of Community Mental Health is an unprecedented commitment to promote mental health for all New Yorkers. Our hope is to promote mental health for our youngest New Yorkers, which is one of the reasons we're doing this presentation today, but also to reach people with the highest need, to strengthen crisis prevention and response, and to eliminate barriers to care. So at the end of these two-part sessions, technical assistance series specifically, we hope that you'll gain an understanding of mental health spectrum and mental health crises. We hope that you understand the importance of implementing an organizational crisis navigation plan, and hope that you learn how to create and implement a customized crisis navigation plan that's specific to your organization. Now, we want to note that this isn't a specific training or a specific task that anyone with a specific mental health background should be taking on. This is a task that anyone and everyone should be taking on within your organizations. When a young person is in crisis, it's everyone's responsibility to help them and navigate through that process and to refer them to the appropriate care possible. So it's important to note that this is for all of us to learn, for all of us within our organizations to kind of think about how to implement a crisis navigation plan and think a little bit broader about crisis navigation. So as we stated, this is a two-part series. For today, we will be setting the stage. So we'll define mental health crisis and crisis navigation. We'll introduce some warning signs and symptoms to mental health and mental health challenges. We'll also review relevant organizational policies, identify strategies to increase safety and decrease harm, and identify site-specific and community-based resources. Now, during the next session, during next Thursday, we will be now taking on everything that we will go through today and actually drafting an organizational plan a crisis navigation plan for your organization. So we will be kind of piecing apart what we learned today and creating or drafting our own navigation plan from there. So stay tuned for that. Now let's begin by defining mental health. And mental health is best to see it as a spectrum. We can all have highs and lows throughout our days, depending on what we're going through, depending on what life events we're going through, or even what our emotions are for that day. So we do want to clarify mental health, and just the word or the phrase mental health is a state of well-being in which people can cope with normal stressors of life, can work productively, and contribute to their own communities. So this is neither a positive or a negative, it's just a state of well-being and a state of how you can cope and how you can move on through your daily tasks. Now, a mental health challenge is a broader term that recognizes that we may all experience emotional distress related to stress, related to loneliness, or related to grief. As I mentioned a little bit earlier, the last year has impacted our youth in ways that it has increased their anxiety and depression for many. So this may be a mental health challenge that they may be going through, and they may be able to find some support that can help them navigate through that. Now, a mental illness is a diagnosable condition that can negatively affect someone's day-to-day functioning. This can include depression to the point where you're not able to go to work or go to school, not able to wake up to do your daily duties. Can also include anxiety, schizophrenia, and addictions, just to name a few. So for today, we'll define just some key terms that you'll probably hear back and forth throughout our presentation. Crisis is any situation in which a person's behaviors can put them at risk of hurting themselves or of hurting others, and they're unable to resolve the situation or to cope with the skills and resources that are already provided or that are available. Now, risk factor is a biological, psychological, community, or a cultural characteristic that can increase the effects and impact of stressful life events. So these are specific increases or specific events, specific situations that may happen to a person that may increase the chances of developing mental health challenges. Now, protective factors similar to risk factors are those events, those life circumstances that can decrease the chances of developing a mental health challenge. So a protective factor, to name just one of many, can be the adult relationships, healthy adult relationships in children's lives, and having that connection to an adult who can guide them to the right path, to the right supports that may be needed at the time. Now, warning signs are specific and individualized changes in behaviors that can help identify the development of a mental health challenge depending on severity and how it impacts their daily life. Now we're going to move it on to Dr. Christa to explain a little bit about what crisis navigation planning really is.
Sure. Thanks so much. So, when we are working in our organizations, we frequently will have protocols and procedures in place so that everybody on staff knows exactly what to do. We hold things like fire drills, not because we expect there to be a fire all the time, but because in the case of a crisis, we want everybody not to have to think, not to have to figure stuff out. We want them to just know what to do with a clear set of steps. And the same type of planning can be applied in your organization for mental health crises. So a crisis navigation plan is going to be a list of organizational strategies and resources. It's going to be things that your organization is going to use so that anybody interacting with a youth who's in trouble is going to be able to assess for and maintain that youth's safety and reduce the risk of harm if a young person is experiencing a mental health emergency or crisis while you're working with them. So the nice thing is this is going to help your organization not only deal with the crisis in the moment, but also guide decision making to help prevent future crises or mitigate crises that are in progress, and also support the mental health more generally of all the youth that you interact with. And as was previously mentioned, this really ensures that all staff in your organization are prepared. Sometimes when we have crises, these sort of things might fall on the one or two mental health trained folks at your organization. And sometimes there just aren't enough mental health folks to go around. Really, it's better for everyone to have a baseline level of preparedness. And this is going to set the stage so that way anybody who's interacting with a youth is going to feel prepared to do what they need to do to help that youth and keep them safe if something were to go wrong. All right. So how do we know if something is going to go wrong? The very first thing that we need to do is really just have awareness of what's going on with the kids that we work with. And we really need to recognize signs and symptoms of distress. There are certain signs and symptoms that could help you recognize when someone is experiencing a mental health challenge. And again, you don't need any special training. Just the time that you spend with a kid, you're going to be able to see if something seems different, if something seems a little off. These are the types of signs that might get your spidey sense tingling that, maybe something isn't okay with this kid. And so sadness or withdrawal from daily activities are going to be good ones. If this is usually a kid who's bright and engaged in activities at your organization, but now you find they're kind of sitting alone or they don't seem to enjoy the things they used to do, that sort of change might be the sign of a brewing crisis. Certainly, if you're seeing a youth engage in self-harming or risk-taking behaviors, a lot of our youth in trouble will engage in non-suicidal self-injury, behaviors like cutting or banging or burning the self, on purpose. Or they might engage in risk-taking behaviors where they're doing really risky things and not really caring if they're going to get hurt. That's definitely a sign that something is amiss. We want to pay attention if we have kids that used to really love our activities or be really engaged in school or sports or something that they had passion for, and all of a sudden those things just don't seem to matter to them anymore. And also if we're just seeing like their mood swing wildly, like they used to be pretty even keel or laid back, but all of a sudden there's a lot of, switching from okay to not okay rapidly. Or you find that they're really like tired or fatigued, maybe they've been having nightmares or sleeping poorly. Um, a lot of times in adolescents and young people, symptoms like depression or anxiety actually manifest as irritability, anger, lashing out at other people, having more interpersonal conflicts. So this sometimes can kind of mask that internal pain, by kind of lashing out and, not being as pleasant to other people. Sometimes the opposite is true. Maybe they're going to start avoiding other people or withdrawing into themselves. They're not as open or talkative as they normally have been. And certainly any utterances where they're expressing hopelessness for the future, feeling like things are terrible, they're helpless to change it, there's nothing they can do to change their circumstances, things are awful right now, and maybe they're going to be awful forever. That kind of hopelessness and helplessness is really a breeding ground for mental health crisis. This is only made worse if the person blames themselves for this situation. So it's one thing if the world is rough, but it's even worse if you feel like it's your own fault and you brought this upon yourself. And lastly, another thing we want to keep our eyes out for is hypervigilance. And so what we mean by this is, does this adolescent or youth seem on edge? Are they always looking, like jumping at loud sounds or being afraid if folks move too quickly? That might be a sign of exposure to violence or, fear of a threat in the environment. So, these are not a comprehensive list. Certainly there's other things that might be worrying that are specific to the youth that you're working with, but these are usually good signs that, if we're seeing this all of a sudden, this is something new, a change in the youth we're working with, then we might be concerned. We might want to think about approaching the youth and see what's going on. Now, just a caveat that these warning signs might not always be present in the event of a mental health crisis, but a lot of times when we have a crisis, we can kind of look back and notice that maybe things had changed, maybe things are not right. And if we can get a plan in place to address it early, hopefully we can mitigate those things that are changing and we can keep a crisis from escalating. And so, what should a crisis navigation plan entail? Well, first of all, like we just mentioned, there are some warning signs. There are some signs and symptoms that things may be brewing. So we want to make sure that we have a good list for our organization of things that staff members should be aware of. Warning signs both within the individuals we work with, and also situations that may be occurring in our organization where we may need to deploy and do something to address this brewing crisis. Next, we want to identify staff who can help within your organization. So certainly we want everyone to have a basic level of understanding of what to do and a basic skill set to address a problem. But there are probably some folks that are in leadership that need to know about these things. There are probably some folks that have additional training that might need to step in if a crisis escalates. So we want to know who those people are and how to get a hold of them in case we need them. Next, we want everybody at your organization to know what to say and how to react in the moment, because we can't, necessarily predict when a crisis is going to happen. And it's going to make our staff feel more prepared and more confident in their abilities if they know what to do. So we're going to talk about, what sort of things we need to think about. In particular, the three main ones is that we need to assess for harm and put some strategies in place to promote safety in the moment. So making sure that nobody is going to get hurt or that this crisis won't escalate in the moment at our organization. We also want to have our staff have some supportive communication methods so that they can really communicate with this youth and really find out what's going on to try to make things better. And lastly, we want to have a list of de-escalation techniques that anybody could deploy so that if a young person is experiencing a crisis, we know what to do to keep that situation from getting worse. Um, the fourth component is going to be identifying stakeholders within your organization who should be alerted if a crisis occurs. And lastly, we're also going to identify external resources that can offer emergency and ongoing support. It may be that our organization is not equipped to provide the type of treatment or the ongoing support that a youth needs, but we want to have these external resources available in case we need emergency services, in case a youth is going to need additional support out in the community, so that we can really help facilitate those connections. All right, so here is our pretty crisis navigation planning worksheet. This is going to walk you through the steps of what a crisis navigation plan for your organization is going to look like. And so this is going to be a resource that's going to be sent out to you so that you can start thinking about, okay, what are these steps going to look like in my organization? Who are the support staff that I can call upon? What are the procedures that are going to work for our workflow and our population that we work with? Um, and so next time, we're going to actually start constructing those plans for your organization. But this is just a preview of the worksheet that you're going to receive and the steps that we're going to be walking through in order to get your crisis navigation plan up and running. All right. And so the first step on this crisis navigation plan is going to be identifying those warning signs. And the reason warning signs are important is that you need to know when to implement this crisis navigation plan that you put into place. You don't want to wait until a crisis is full blown if you could have started a little bit earlier and prevented it. So you want your organization to have a crisis navigation plan that can deploy before a crisis starts. And hopefully we can keep it from escalating and mitigate those circumstances. So if you notice that some of the youth that you're working with have a mental health crisis that may be developing, or if you're seeing like emergence of new symptoms, intensification of risk factors that we discussed, maybe you're seeing those changes or those warning signs that something doesn't seem right with a kid. Well, that's when we want to deploy our crisis navigation plan. We don't want to wait until something bad goes down. We want to make sure that we can step in and hopefully get this youth the support they need so that a crisis doesn't have to develop. So again, some signs may include changes in family structure or relationships. A lot of times our kids are dealing with a lot at home. So if there's been a recent divorce or separation, maybe they're moving between households, maybe they have unstable housing, where they're not necessarily even sleeping in the same place every night. These things are so disruptive to our kids' development. The same thing is true with loss of important relationships or changes in important relationships. Maybe they had an important mentor or a family member that's passed away or is no longer in their life, or they lost a really supportive, significant other. These things can be really crushing. They're important protective factors in our kids' lives. And the loss of an important protective factor can unfortunately really switch to a risk factor. Generally, loss of any kind, whether this is due to death, relocations, changing in their life circumstances, can be very stressful for our young people. Conflicts or arguments, whether it's with a peer group or within the home, can be a breeding ground for depression and anxiety. Certainly experiencing trauma or exposure to violence, if there's any sort of bullying or victimization, whether this is at school, in the home, or in the community. This is particularly salient if this bullying or victimization or violence is related to some critical aspect of their identity. So things like, bullying for being LGBT or for racial or ethnic minoritized groups can be really potent risk factors in a brewing mental health crisis, because it feels like something that they're being judged for something that they can't change, and they're being ostracized for part of who they are. So these experiences often precipitate mental health crises. Again, also just sometimes our kids are facing a lot in their life. So mounting life pressures, whether this is in their own lives or in their family lives, things like loss of employment or loss of housing, can really make the home unstable. And sometimes a lot of responsibility falls upon our youth to try and hold their family together. And that can be a lot of pressure for a young person. So all of these can be warning signs that we may need to implement our crisis navigation plan to get this youth some support. So next, if we notice that there is a youth who might need some support, the next step on our plan is going to be identifying staff who can help. So it's going to be important that we have internal resources and we identify the folks within our organization that are really suited to this role. We want everybody to have that basic skill set so that everybody can intervene and do what they need to do to help youth. But there's also going to be some staff who have really strong relationships with the young people in their program. Um, and so if you know somebody on your staff is super close to this kid, maybe they would be a good person to approach them because there's already that natural support, that natural relationship in place. And the kid may be more willing to open up to this person since that natural relationship is already in place. And that person may be better equipped to determine the ways that your organization can provide support. If you have some folks that really have established good rapport with young people at your site, you want to start thinking about who those folks are. You want to think about who are the folks who are really good with working with youth, who are the folks who can really like calm people down, get them to laugh, get them to smile again. These are going to be the folks that are going to be your internal organizational resources that you can deploy when somebody needs help. We also want to think about our second line of defense. So there's going to be, your front line of defense where everybody has some skill set, but it could be that this mental health crisis escalates and you need some backup. And most folks feel a little uncomfortable trying to de-escalate a crisis if they don't have mental health training and they don't know who their backup is going to be. So you also want to make sure that you have a good, clear list of the staff who do have a background in mental health or behavioral health, who know crisis management, and folks that are going to be able to be there to help out if there really is a need for backup. So this can be a wide number of people. This is not necessarily just your staff social worker or psychologist. There's lots of folks in your organization who may have background in training in de-escalation and crisis management. So this is the time to think about our safety officers and our agents that, already are known to be able to de-escalate situations. Certainly social workers and counselors have this background, but also, like nurses, anybody who's worked in the medical field or worked in public service may have this skill set. And so we want to think very carefully about who our backup should be so that everybody feels supported to do the work that they need to do to intervene. All right. And so then, probably the most critical part is for all of the staff in your organization to feel confident that they know how to react, they know what to say, they know what to do. Most of the time, it is not that staff don't see changes in youth, it's that they're not quite sure what to do next. They see something and they're uncomfortable and they're like, what if I make this worse? What if I say the wrong thing? There's a lot of anxiety. And so sometimes we just avoid the situation where if we had stepped in and knew what to do, maybe we really could have helped support that youth earlier. So we want to give that support to our staff to know what to do. We want them to know how to conduct a safety assessment. We want them to be able to employ supportive communication methods and de-escalation practices. And we really want everybody to know how to navigate to resources so that they can help facilitate and liaison for this youth if they need additional services outside of our organization. And so what's our first step? Well, first and foremost, safety always has to come first. So if we are worried about a youth, we need to assess for their safety in the moment and immediately employ strategies to reduce their risk of harm. So one of the ways that we can do this is building into our crisis management plan in advance, long before a youth is in crisis, what sort of things in our physical environment we should be aware of. So we want to review spaces in our organizations where we hold our programs to make sure that they're going to be safe in, if a crisis were to present. And then we want to think about how we can structure these spaces to reduce harm and make sure that they can be accessed easily in the case of an emergency. So first of all, we want to think about spaces that should not be utilized. So there may be some spaces in your organization that just are not safe for youth if they are experiencing a mental health crisis. So we want to think about rooms that might have heavy, large objects that are unsecured that somebody could throw and possibly hurt themselves or somebody else. We want to make sure that we're not leaving youth unsupervised in places that have unlocked or unprotected windows or that have egress to the outdoors, because we want to make sure that if our youth is in a crisis, we can keep them safe and we can keep them well supervised. We don't want to allow for flight risk, and we don't want to allow for anything that could potentially let them hurt themselves or hurt somebody else. We also want to think about things in the environment that might be dangerous. So if you are in, if you've moved the youth to a private space like a private office, do you have scissors and a pencil cup on your desk? A lot of our office supplies in a pinch could be used in a dangerous manner. And so we want to think about, like, if we're moving a youth to a private space to de-escalate, is there a way to have a private space that's already been sanitized and doesn't have these dangerous objects freely available? Maybe we put them in a drawer, or maybe we have a private space that doesn't have these things out and lying about. Something that a lot of people don't necessarily always think about is ligature points. So if we are leaving a youth alone and they have access to a belt or shoelaces or some sort of lengthy object, the most common method of suicide attempt in New York State for young people is death by hanging. And so we need to be very careful that there are not things that young people could use in our environments in order to harm themselves in this way. So things like hooks that are hung on the back of the door that are weight bearing, even weight bearing doorknobs sometimes, or a high piece of furniture where they could throw something over it. We want to be very careful that if we are leaving youth alone in a space, that ligature points and things like that are not available. Or if we do have a hook on the back of the door, that it is hung in a manner that it will break away after a certain amount of weight is applied. So maybe it's enough to hold our coat, but it's not going to be enough to hold, a child or a young adult's weight. And so things like that are small things that exist in all of our environments that we need to be aware of to keep youth safe in these situations of escalating mental health crises. So in addition to thinking about the spaces that shouldn't be utilized, we do need to think about the spaces that should be utilized, spaces that are private and that are not going to pose a risk. Now, I know in the city, space is always an issue. Like, we are always in tiny spaces. We never have enough space. But we probably do have places in our organization that could be utilized in this manner. If we have sensory rooms, if we have an empty room or spaces with limited access, usually getting a youth to a place that's private can help de-escalate a crisis. It can also keep that youth away from other children who might be disturbed or potentially harmed by the youth that's in crisis. So this way, we want to get the youth to a private space. And again, we want that space to be preferably a room without windows, or at least windows that don't open. We don't want there to be doors to the outside where the youth could potentially flee. And hopefully we want there to be like a minimal amount of objects that could potentially be tossed about or used to injure themselves. We want this to be a pretty clear, empty, private space if possible. Next, we really want our navigation plans to have protocols or guidelines to follow to protect others at risk of harm. It's entirely possible that while we're holding our program, one youth may have a mental health crisis, but there's going to be a bunch of other kids there. And we don't want those kids to be frightened. We don't want those kids to be potentially hurt by this young person who's struggling. And so we need to make sure we have protocols for if there are other young people in the room during a crisis, what do we do? Do we remove the young person who's having a crisis to a private space? Do we remove the other youth to a different space in the organization? How do we supervise both of these folks if we're bringing them to separate spaces? Can we ask other staff to escort the youth in crisis to one of the safe rooms? Or do we ask that other staff to escort the group of youth to the gym or an open space area? We don't want to be figuring this out on the fly. This is the reason why we have clear fire drill protocols, that we know exactly what to do, who's in charge, where to go. And we need those same level of detail in our protocols if a mental health crisis were to take place in our spaces. Lastly, we really need to be clear on which staff can assist to ensure safety and the best way to get in touch with them. So if you are doing your best job to de-escalate this crisis and the kid is still not okay, maybe this young person is really out of control and really suffering, maybe you're going to need to call in that backup, and you need to know who that person is and how to get in touch with them easily. All right. So let's say we've got this youth who's in crisis. We've got them to a safe place. They're in one of those safe rooms. The other kids are taken care of. And now you're here to really figure out, like, what's going on? Like, what brought you to this? What's going on here, and how can I help? So when we are speaking to a young person about their mental health or about our concerns, we really want to use supportive communication methods. Sometimes we're so worried that we get very pressured. We start bombarding them with a bunch of questions, or we start trying to smooth things over right away. And we're not really putting the youth's needs first in that moment. We are putting our own anxieties first. So really what we need to do is we need supportive communication methods so that we can be there for the youth. So the acronym that we use here is LEAP. That stands for listen, empathize, agree, and partner. So sometimes our impulse is to jump in and start asking a bunch of questions or try to fix the problem. And oftentimes that causes people to escalate. They feel like they're not being heard. They feel like they're not being supported. And so instead, we want to listen. We want to let them talk. We want to listen without any judgment. We want to listen without trying to solve things. And if we are going to speak to the youth, we want to use reflective listening. We want to kind of summarize back what we're hearing. We want to validate their emotional experiences. And this allows us to make sure that we're getting it right and have the youth feel supported, that you're really taking the time to hear their concerns and hear where they're coming from. Next, we want to empathize. We want to express empathy. We want to show that we understand, that we know that this youth is hurting and that the situation that they're in is really tough. And we need to be able to really listen first so that we can be sure that we have a clear understanding of their feelings. Next, we want to agree. We want to find common ground. We want to find areas where we either agree on something or we disagree on something. So this is a good chance to kind of like validate what you're hearing from the kid. Like if you're hearing that stuff at home is rough, be like, that sounds like it's really hard. Like everybody would be struggling in that situation. Find an area where you can agree, where you can join with them and be like, yeah, that sounds really rough. Or find an area where you disagree. Like, of course, nobody would want to be in that situation. It's no wonder you're really, struggling with this. And then you want to move to a place of partnership. You want to form that partnership to achieve a shared goal. So, of course, nobody would want to be in that situation. What can I do to help you? Can we come up with a plan to make this a little bit better for you? So we want to identify what this kid's goal is and hopefully offer some support so that you guys can partner together to help them achieve that goal. Now, sometimes those supportive communication strategies work like magic. Sometimes just having the opportunity to talk about what they're going through can just calm a kid right down. Like just the fact that they're being heard and that somebody cares can be incredibly powerful for them. But sometimes that's gone too far. Sometimes all the supportive listening in the world is not going to help a kid who's really out of control, who really can't manage themselves in this moment. If a crisis gets that far, we really need to be prepared to use de-escalation tactics so that the kid is safe, so that everybody around them is safe, Sometimes it can be really difficult for a young person to clearly communicate their thoughts, to communicate their feelings, or even know what they're feeling, because it might be a wild mix of a bunch of different things. Sometimes those emotions are so overwhelming in a moment of crisis that they really can't regulate themselves. And so we need to support them in this process of regulation and help them to de escalate. So what we want to do is, again, we want to connect using those supportive, those supportive communication strategies. But we ourselves want to stay calm. If they're freaking out and we're freaking out, that's a bad scene. So we want to make sure that we are taking it a level below them, that we're staying calm and cool and collected. And then we want to de-escalate the situation with the following techniques. So we don't want to overreact. We want to make sure that even if we're freaking out inside, that we're chill on the outside, that like we feel like we've got things under control, and knowing what to do is going to help us do that. We again want to express our support and concern. Like we don't want to escalate this situation. We want to say, like, I'm concerned about you. What I'm doing is out of my concern for you and your safety. Like, I want to help in any way that I can. Next, we want to ask, how can we help? Not necessarily solving the world, but what can we do to help you right now so that you feel better? What can we do to improve this moment so that you are not so distressed? And then we want to offer options instead of taking control. A lot of times our gut instinct is to jump in with like, you should do this or you got to do that. And that makes a person who's out of control feel like they're even more out of control. And sometimes that can escalate a crisis. So sometimes providing a short list of options can be a good way for them to feel like they have some control and some agency in this situation. So maybe we're like, okay, why don't we try to relax? There's a couple of different things we could do. Maybe we could talk about this, or maybe we could go through some breathing exercises. Maybe we could, go to the gym and just take a walk. Like, what do you think would help you most? And giving them some options allows them to really think about how they can improve the moment and have some agency in this decision. Once an option is identified, we want to announce the actions and always announce our next steps before initiating them. So some of our kids have a history of trauma. Some of our kids have been through tough stuff. And if we move too quickly when they're dysregulated, it can be frightening. It can be triggering, and they may react in an erratic or aggressive manner if they're really distressed or triggered in that moment. So we want to make sure that we are keeping our movements calm, slow, and that we're announcing our actions before we do them. So like, okay, we're going to go to that next room now, or all right, like, I'm going to take that object and bring it over here. Is that cool? Just that way, they're not feeling blindsided. They're not feeling as though, something threatening is happening rapidly, faster than they can respond. Lastly, we want to make sure that we do not touch the young person unless we ask permission. So again, sometimes our gut instinct is to be like, oh, come here and give them a hug because we feel bad that they're suffering. But again, many of our youth have a history of trauma. Many of our youth might be frightened if we approach them too quickly, or feel like we're invading their physical space if they're distressed. So if we are going to approach a youth to touch them, we want to make sure that we have their permission first. We want to say, like, is it all right if I kind of like guide you on the back? Or, like, if we know it's a kid who likes hugs, like, is it okay? Like, do you want a hug? That way we give them the choice and they maintain their bodily autonomy. It's not us invading their space, which could be perceived as threatening or frightening. We are putting their needs first and letting them know and asking their permission before we do anything. So next, if a crisis has been managed, we need to identify the internal stakeholders who really need to know about this. If one of our kids has had a crisis, there's folks within our organization that need to know so that everybody can be aware that this kid may need some extra support. So during a crisis, it's going to be important to inform these stakeholders of the incident. And this is going to make sure that you're getting the support you need, the youth is getting the support they need in the future, and that everybody is complying with whatever this existing protocol is that you develop for your organization. So you need to have a list of key stakeholders. Oftentimes, this is going to include leadership or the program manager. And we need these key stakeholders within your organization. And then we need like a telephone tree or a text tree, however your organization works, in the order that they should be alerted. So your plan should have a list of these individuals in the order that they should be alerted. It should include all of their preferred contact information. So does this person want to be notified by text, phone, email? And also include next steps if the stakeholder is not available. None of us are perfectly available. There's always a time that somebody's in an elevator or in the bathroom. And so if we cannot get the primary person on this list, we need to know who is next on the list to contact and how we reach out to that person. Then our final step is to identify local resources that can offer either emergency support or ongoing support. So our organizations usually have a mission, and our mission may not always be able to cover all possible situations that occur. It is possible that in case of an emergency, we may need to deploy, call in additional external resources to help in that emergency. In the same way that if we were to have a fire, we call the fire department. We don't put it out ourselves unless it's really tiny. If we're having a small crisis, we might be able to put it out ourselves. But if we are having a large crisis, if we are having an emergency, we may need external emergency services to support us through that process. So we need to have a clear list of local emergency mental health services that can be utilized if the crisis cannot be de-escalated by our staff. And we also need to know, even beyond that, services that we can use in the immediate emergency, how do we get this young person ongoing support? It may be that they need more than our organization can provide for them. If this youth is unhoused or this youth needs mental health treatment, those are things that our staff may not be equipped to do. That may not be the mission of our programs. And so we want to be able to facilitate this process so that it's easy for this youth to get the support they need to maintain their mental health. So we need to make sure that we list all of the mental health support services that we do have within our organization, and also know what's available in our community that's going to be easy to access. So is there a local mental health clinic that you could refer a youth to if they need services? Where's your local crisis treatment center? Do you know if there is a comprehensive psychiatric emergency department near you? Is there a local emergency department that does a good job with receiving psychiatric cases, even if they are a medical department? Knowing these resources is going to help us be prepared to know what to do in an emergency. We also want to make sure that our providers are partnering with local clinical services. We don't want to just hand a kid a referral and send them off into the night. We want to make sure that we have relationships with these people, that we know, that we can, refer folks there and that they're going to get the support that they need, and that we can support them through the process and know what the process is for getting into services at a local organization. And the way that we do that is by liaising with these organizations and knowing what appropriate procedures are going to be, so that the youth and their family doesn't have to figure it out while they're in crisis. It can be so challenging if there are linguistic issues or there are barriers based on access to care. And we can help smooth those barriers if we know what to do and can help guide the youth and their family through this process. We also want to have a clear list of emergency resources that can be mobilized. We have mobile crisis teams. Now, the thing about mobile crisis teams is sometimes they're slow to deploy. Unfortunately, we do have more crises than we have mobile crisis team members. So sometimes that can be a bit of a slower response. And we need to really think carefully, like, is this something where we can de-escalate and keep the youth safe and wait for mobile crisis to arrive? Or is this something where we really need to immediately engage emergency services? We really want to reserve calling emergency services, calling 911, for situations where the young person poses an immediate danger to themselves or others, and you're really unable to stabilize them even for the moment. The best case scenario is that we want to stabilize them in the moment. The next case, if you feel like they need additional services, but you can keep them safe for now, then we really want to be utilizing mental health services like mobile crisis. And we really want to rely on 911 as the last resort. Because we do not want, sometimes the experience of contacting emergency services can be traumatic for people. And so if we do need to call emergency services, if we do need to call 911, we want to make sure that we're requesting an officer who's trained in crisis intervention. We don't want folks to be responding as if this is a police or a legal manner. We really want somebody who's going to be empathic and trained to engage in crisis intervention with the youth we're working with. Now, in the city, here is a nationwide mental health emergency crisis line. This is going to be 988. So we're not going to have to be calling 911, and connecting to police services. Hopefully, we'll be able to connect to a cadre of well-trained mental health professionals for our mental health emergencies and reserve emergency services for the type of emergencies where folks are, really trained to respond. All right. So I'm going to give you a scenario now. This is going to be, you're having a regular day. Peter is a high school sophomore who attends your program. He comes there 3 days a week, and he's a great kid. In the past, Peter's always been outgoing. He's very energetic. He takes great pride in his appearance. He's a snappy dresser. He wears stylish sneakers. He's always got a fitted hat that matches his outfit. And he's always been very participatory. He really enjoys participating in the program activities, especially in sports. He's really athletic, and he's been a very active member of your youth leadership council. So Peter's a great kid. But recently things have started to change. So recently he seems moody. He hasn't been arriving on time to your program. And he just doesn't seem to have interest in the stuff that he cared about before. He isn't joining in when other folks are playing basketball. He's not working out with his peers anymore. And you notice that where Peter used to be in like bright, vibrant colors and coordinated outfits, now he seems to be kind of wearing darker colors. He doesn't really seem to be taking that same interest. Stuff isn't matching, stuff isn't coordinated in the way that he used to take such great pride. And now instead of hanging out with his friends at the program, he's just kind of like sitting by himself in the back, looking at his phone, kind of withdrawn and away from everybody else. And so, maybe we've got some warning signs here that stuff might have been changing for Peter. But today it comes to a head. At program today, Peter can barely stay awake. He's like falling asleep on the table. He's just kind of sitting in the table in the back with his hoodie up, and he's got his head down. He looks like he can barely keep his eyes open. And when you try to talk to him, he kind of seems out of it. He's very disoriented, and he just tells you that he feels hopeless. He wants to disappear. Everything's terrible and nothing's going to change. And so this is a crisis that could happen at your organization. Do your staff who work with you day to day know what to do next? You would hope that your staff are prepared, that they would have noticed that things haven't been going great for Peter. Maybe they're going to approach them and ask if he'd like to share more about his feelings, if he'd like to talk about this. Maybe you want your staff to explain that they can work together to try to find supports to help him feel better. But what happens if before you can take Peter to a private space to talk this over, he blows up? All of a sudden, he feels like he's being picked on. He starts yelling, "Why are you picking on me? Why can't you just leave me alone?" And he just starts, he's got a water bottle there and he just chucks it at one of your staff members. And after this, he kind of comes to himself. He realizes that he blew up, and he just grabs his head and starts to cry because, he's overwhelmed. What do you do next? How would your staff, how would you in your organization help kids like Peter in this situation? Well, that's the point of your crisis navigation plan. We don't want to wait until Peter's crying in front of us to be like, oh God, what do I do next? We want all of your staff to be prepared that if a kid like Peter is starting to show warning signs, they know what to do at every step of the way. And if Peter blows up like this one day at your program, you know what to do to help de-escalate that situation and get Peter the support he needs. So next time, we're going to be walking through a crisis navigation plan and helping you to identify what needs to go on your organization's crisis navigation plan and how your organization could better handle these types of situations.
Thank you, Dr. Christa. Thank you so much for all that information. This leads exactly to our next steps for next week. Thank you all for being on this call. Don't hop off yet. We have a few more things to talk about, but we did want to give you the next steps for next week. For next week will be, or during this week, as we lead to next Thursday's session, we want you to reflect on crisis navigation planning, on everything that Dr. Christa provided us today. Why is this important, first of all, for our organizations? And what resources are needed for your specific organization to get this navigation plan started? Start thinking through how can your organization implement a crisis navigation plan? How can you maybe start drafting that crisis navigation plan? So assess your organization's current mental health policies, if there are any, and processes. Currently, some organizations have a protocol similar to fire safety, a fire drill, something similar as a mental health plan, or something in the lines of including a mental health kind of next steps. Does your organization offer that? Does your organization have that in place as of now? And how can we enhance the current plan or the current policies at your organization to include a crisis navigation plan? Or how can we implement a crisis navigation plan in your organization? So think that through moving forward towards next week. Now, as we mentioned, we provided you with the worksheet, and that worksheet will send out by the end of today's session, where you will be able to kind of look through and kind of read through what is it that we need? What are those warning signs that we may be able to see? What are some de-escalation skills, or excuse me, de-escalation techniques that we can implement at our organization? How can we assess for safety and harm? And lastly, we always want to leave you with resources. As we stated, a big part of the navigation plan is to include local and external resources that you can utilize at any time. So thank you. Thank you everyone for joining us today. As we said, this is only part one. So please join us next week. Make sure to register. We will send out reminder emails, and we'll also send out the worksheet so that you can review and have that handy for next week. Thank you everyone, and have a great day. So again, the Mayor's Office of Community Mental Health is an unprecedented citywide commitment to promote mental health for all New Yorkers. Now, our goal for this two-part series was to gain an understanding of the mental health spectrum and mental health crises. This is something that we went through last week, just a general understanding of what is mental health, an understanding of the importance of implementing an organizational crisis navigation plan. Why is this important? Why is it important to have within your programs and organizations? And for today, we'll learn how to actually create and implement a customized crisis navigation plan for your organizations. Now, we want to remind you that this crisis navigation planning is an organizational, all staff included responsibility. This does not fall just on one person. This does not fall just on the social worker or the mental health professional at your program, but all staff, regardless of their roles, regardless of their mental health background. So we do want to note that. So to get started, Dr. Christa will provide us with a little bit of background of what we went through in part one.
Yeah, so we're going to go a little bit quicker this time because I know some of you were here last time, but we wanted to still go through, give a good review, and that way we can kind of help catch up anybody who's new here this time. So basically the whole point of this is to really think carefully about how your organization can approach crisis navigation planning. A crisis navigation plan is going to give you a list of organizational strategies and resources that can help folks, at your organization assess for and maintain safety, reduce the risk of harm if a young person in your programs is experiencing a mental health emergency or crisis. Unfortunately, by the time it reaches the point of a crisis, it's usually pretty obvious that somebody is struggling. But what we really want is our organizations to be prepared, to be able to know what to look for, to be able to think ahead and be ready to respond to folks who are struggling, hopefully to prevent crises in general. But if a crisis is to occur, to make sure that we have a clear plan so that all staff feel supported and feel like they know what to do. So the goal here is going to be to help your organization guide decision making. This is going to allow you to mitigate future crises and also support the mental health of the youth that your organization serves. Lastly, it's going to make sure that all of the staff in your organization feel prepared to follow the protocol in the event of a crisis. So again, this should not be something that only the social worker needs to think about. We really need everybody on board when it comes to supporting the mental health of the youth that we serve. And the best way to do that is to make sure that all of your staff have a clear protocol, that they really understand what the steps are going to be and what they need to do next. And so, what is entailed in a crisis navigation plan? Well, there are 5 components. First of all, we need to think about what warning signs or situations would be where we would want to subsequently deploy a crisis navigation plan. So we don't want to have to wait until it's super obvious that bad things are going down. We really want to be keeping our hand on the pulse of what's going on with our kids, making sure that we are aware of warning signs or negative life situations that may be putting our kids at risk or make them more vulnerable for having a mental health crisis. Once we've got a good, clear list of what we should be looking for, this can help us identify problems earlier so that we can respond appropriately. Next, we want to make sure that we're identifying the staff who can help within our organization. So we don't want to have to be figuring out on the fly during a crisis who we need to turn to, who might have additional training, who could be useful in a crisis. We really want to have all of that information clearly listed out on our crisis navigation plan so that all staff members know who these individuals are and how to get a hold of them. Next, we want to give every staff member at our organization, everybody from the CEO down to the janitor, basic skills so that they feel prepared and they know what to say or how to react in the moment if a crisis is to occur with one of the kids in our programs. So this knowledge is going to include assessing for harm and using strategies to promote safety for the youth that's in crisis. This is something that everybody should know how to do, so that if our youth is struggling, everybody feels confident in being able to approach that youth, see what's going on, see if they can help. Next, we really want everybody to feel comfortable using supportive communication methods because we know this is the best way to approach somebody who may be struggling, and the best way for us to get the information that we need to help this youth. And lastly, we want everybody to be aware of a list of de-escalation techniques that can help you support the young person if a crisis is to occur. A lot of times, staff members feel reticent to approach a young person who may be struggling because they feel like they don't know what to do if something were to go wrong. And so this way, you're going to know exactly what to say, what you should do, and how to approach this. Just in case your spidey sense starts tingling and you feel like maybe something's not quite right with a youth in your program. So fourth component is going to be to identify important stakeholders within your organization who should be alerted. So if you do notice that maybe a mental health crisis is brewing for a youth, or you needed to de-escalate a situation in your program, you really need to be aware of who in your staff needs to be notified. Oftentimes this is leadership, but you may also want to know who's available for support, who has, crisis de-escalation skills, whether that is your public safety officers or your social workers. You want to be aware of who your backup is in case you feel that you need additional support. And you also want to be aware of who on your team it's important to be aware of what's going on in your organization to make sure that leadership is aware, and that way we again can keep a pulse on how the youth and organizations are doing. Lastly, we want to identify external resources that can offer both emergency and ongoing support. This is going to be really important because our organizations, they can't do everything. The mission of our organizations may not be available to provide ongoing care in the way that some of our youth may need. And so we really need to create partnerships with local organizations, local resources in our community, both. So if an emergency onsets, we have folks that we can turn to for that. If we have a fire in our building, we call the fire department. In the same way, if we have a mental health emergency where we really need a higher level of care, we need to know what are the best resources to turn to. Similarly, some of our kids may need more ongoing care that we cannot provide. And so we need to have partnerships so that we know what are going to be the best resources to share and how to connect our kids to these resources so they can be best supported. So we are going to today start thinking about these 5 components and what they're going to look like for your organization. So not just in the abstract, but how would this work for the staff that you have at your organization, and the kids that you are working with in your programs. And so just to set the stage, we're going to revisit a scenario that we talked about last time. Peter is a kid who could be participating in one of your programs. He is just a regular high school sophomore. He attends your program 3 days a week. And in the past, he was a great kid. He was really outgoing and energetic. He was really like a dapper dresser. He took great pride in his appearance. He always had on stylish sneakers. He had a fitted hat that matched every outfit. He really took pride in the way that he looked, and he always was very participatory. He really enjoyed joining in with program activities, especially in sports, but he also was a member of the Youth Leadership Council. So Peter was a kid who was very engaged. But recently, you notice that things have seemed a little bit different. He seemed more moody, whereas previously he was always on time. Lately, he's been arriving late to program, and he just doesn't seem to be interested. He doesn't seem to care about the things that he used to care about. So he's not playing basketball anymore. He's not working out with his peers. Instead, you see, he's just sort of sitting in the corner. He's wearing darker colors. He's just kind of sitting alone and looking at his phone. And it's a big change from how Peter used to be acting when he was attending your program. So already here, you need to start thinking about, like, what are you noticing? What are these changes? And is there anything here that's kind of like pinging on your radar that you're like, oh, maybe something's going on here. Maybe Peter's not okay. So what are some of the things that we're noticing here?
And at this time, you can get yourselves off mute or you can chime in the chat. Feel free to do so anyway.
Yeah, so I'm seeing isolation, withdrawal. Yeah, like his mood, his interest has changed. Maybe he's less interested in the things that he used to really care about, like his appearance or, like engaging in sports, working out with his friends. Just kind of a general disengagement from the stuff that he used to care about, distancing himself from other people, from his friends, from program staff. Yeah, great. We are seeing a lot of things that, like if a youth in your program was exhibiting these signs, you might be a little nervous. You might be a little worried that maybe they're going through something. And again, sometimes staff feel reticent to approach a kid to see what's going on because they're not quite sure what to do. But the point of your crisis navigation plan is that if you see a kid like Peter in your program, these warning signs are going to be noticeable to you. They're going to be noticeable to your staff. And the nice part about having this plan is that you're going to have these steps to walk through that you know what to do next. All right. So before we were thinking about kind of warning signs, that first step of the plan where we're looking at warning signs and situations. But today things kind of came to a head. Today at your program, Peter can barely stay awake. He cannot keep his eyes open. He's just sitting at a table in the back. He's got his hoodie up. His head is down on the table. He seems really out of it. And when you try to talk to him, honestly, he seems like really disoriented, and he begins to tell you that he feels hopeless. He wants to disappear. And so clearly you're going to be concerned. You ask Peter if he'd like to share more about his feelings, explain that you can work together, that you want to find support to help him feel better. But unfortunately, before you're able to get Peter to a private place to kind of talk stuff over, Peter blows up. You know, he yells, "Why are you picking on me?" He wants you to leave him alone. He throws his water bottle. You know, Peter's kind of out of control. And then he sort of comes back to himself and realizes what's going on. And he just kind of bursts into tears, breaks down, begins to hold his head in his hand and cry. So clearly, like, if we had any question before, now we know something's going on with Peter. And many of you may have experienced situations like this with kids in your programs. So we don't want to be making a plan specifically to help Peter in this situation. We want to be making a plan that's going to be broad enough to address kids like Peter. So kids who maybe are experiencing depression, maybe kids who are going through some difficult life circumstance at home. We don't know what specifically is going on with Peter here, but we know that he's crying out for help. And so we want to put a crisis navigation plan in place so that if a kid like Peter shows up in your program, you know exactly what to do.
So for next steps, we just wanted to provide you with some guidance as to what to do next. You started working on your navigation plans in your groups, and now you kind of have a sense of other organizations, what resources they have, kind of how they would kind of go through this plan. So now we urge you to introduce this plan to your actual program and to your staff, and kind of get them thinking about how can we create this plan on our own and customize it to our own program. Explain to them why is this important and what resources are needed to get started. Start kind of navigating and brainstorming. How can we make this a real plan that we will utilize in our organizations, right? Not something that we'll just create and put it to the wayside, but how can we actually take this on and really make it so that it's feasible and usable for all of our staff? So as we mentioned, we always want to leave you with resources, and that was one of the main conversations going on in the breakout rooms today. One of the things is how to talk to youth about mental health, right? How to communicate about mental health. A lot of us don't have that background. How do we do this? So through our office, we actually created a guide. If you scan the QR code right under the guide, you will be able to go directly into the guide and download that for yourselves. Lastly, we just want to thank you. It has been an amazing 2 sessions for those of you who have been here for both. And for those of you joining us just for today, I hope that today's session was able to provide you some guidance onto how to create your own plans. And thank you everyone. And I wish you a great rest of the week.